Hi there, this video is for the Tafe Skills Assessment in the Unit of Nutrition. For this practice, I will be demonstrating how to feed a hospitalized patient in need of assisted feeding. For this practice today, I will be demonstrating bottle feeding to our patient. First step is always work health and safety. Make sure that all your surfaces are clean, you're wearing the correct PPE, all your equipment and tools are also clean. I usually always have my scrubs on, enclosed shoes, washed hands, gloves, a facial mask, and my hair is tied back and out of my face.
Here I have my typical work shoes or sneaker shoes. Here is my face mask. Here I have my hair tied back out of my face. Here's my trusty scrubs and my scrub hand.
A big part of working with animals and being in the medical care industry is always washing your hands before and after touching an animal. So I'm going to get dish soap. I like to take my watch off so that I get all underneath my wrist. That on the side. And I'm going to rub it in. I'm going to do this for about 20 seconds. Some people recommend you sing happy birthday. I'm going to scratch under my nails because I have long nails today. Do my wrists. It's all pretty much soaked in, you can't even see it anymore. So we're going to turn on the tap, but we're not going to touch the tap handle because it's covered in germs. So we're going to use our elbow. We're just going to activate that soap. And around wrists, thumbs, in between, back of the palm, back of the palm. If you need to, you can go up to your elbow, but I'm just going to be doing my hands for today as this is a demonstration. Alright, once you're all soaked up, tap back on. The water rinse off. Get to squeeze off excess water. Then you're going to get a disposable paper towel, dry your hands, and you're good to go. Once we've got our PPE and our surfaces have been all cleaned, these are all brand new, I just opened them.
So here is the box packaging. I just went to the chemist and got a baby bottle. I wanted a silicone, like a rubber nib, because it's more similar to an actual nipple. It's got the measurement on the side. Here's the box I got. Always make sure that it is dishwasher safe. Here is the Diavectin that I got. You can get these at pet stores, vet clinics. Here it is. There's all the information on the back. It's also on the website. Here I am opening it. It opens very similarly to like a Milo tin. It's got the aluminium foil protective sleeve to make sure that it hasn't been opened before. Always make sure that you're careful when you're cutting around this because the sharp edges and the foil, you can easily cut yourself on this. So if you're really unsure, wear gloves or get a superior nurse to open it for you. You just peel it off. There you go. So you can see it's like a white milky powder. There you go. I have a clean spoon.
We will be preparing the food needed. So today here I have Diavectin, which is a low lactose milk supplement for animals at every life stage, and they use it as a substitute for mother's milk on orphaned, early weaned, pregnant and lactating, convalescing and show animals. So for this scenario, we'll be making it up for a small kitten. Now we're going to go along with the feeding recommendation provided here on the back of the tin, and we can read it here. At the back here there's a table, and you go by the weight of the animal and then relation to the total daily feed volume. So why does this patient require assisted feeding? Well, for this scenario, we have a newborn kitten who was separated from her mother and she needs milk. So we will be simulating her mother's nipple with this baby bottle that I have here. It's brand new. And we want to simulate as close to a realistic mother's nipple as possible. So I've got a silicone tip here. You can get them in a variety of sizes, but it's more realistic. And then the next best thing to actual cat's mom milk is the Diavectolin, which would be our kitten baby formula. And it's a very popular brand, and it's commonly used in a lot of our clinics. So next, we're going to prepare the patient for feeding according to the chosen feeding method. So for this demonstration, I'm bottle feeding.
This is a screenshot from the Tafe student workbook of nutrition about general overall bottle feeding.
Ideally, we'd have a nice little comfy blanket just to keep them warm and keep them stable, especially kittens. They're going to be running around a lot. So for the process of bottle feeding, we're going to select the equipment. We're going to select an appropriate sized clean bottle and nipple for the species and the age of the patient. If not already done, cut a small diagonal hole in the nipple, but we've already got that done for us today. Determine the required amount of formula for the nutrition plan or calculate it off the feeding guide. We've got that here. Keep in mind that the volume milk replacement is limited by the stomach's capacity of the newborn, so the smaller they are, the more frequently they will need to be fed. Couple little tips and tricks. We always want to make up a new formula so that it's fresh for each feed and we're not feeding them stale milk formula. For powdered formula, such as this one, we want to measure and mix the required amount of powder with pre-boiled warm water. We want to mix it thoroughly until it's completely smooth. So we always want to make up a new formula for each feed so that it's always fresh. For powdered formula, we're going to measure and mix the required amount of the powder with pre-boiled warm water. So for this demonstration, our kitten would be about maybe 3-4 weeks old. So generally kittens around the age range can be 8 ounces or 2.26 grams. So we're going to look here and we're going to go with 2.6 grams, 6 milliliters. You can see here, feed per day for the first week of life. Puppies, kittens, fawns, 4 feeds per day. I have our water here, our substitute.
So here I've got my clean spoon, opening it up. I'm just cleaning that. And what you always want to make sure is that you get a knife or a flat tool to even out the scoop levels so you're not giving any extra. And I've just added it into my little bowl. And I'm putting the little scoop back that comes with the packaging. Put that to the side. I have my warm water here. And I'm just going to splash a little bit in. And we're going to mix it around. It's in like a rough paste form here, So I do add some extra water because we want it to be in a more liquid form like milk. If it's too clumpy, it's not going to pass through the bottle, and it's also not very appetizing. So I mix it around until it's completely milky. Once you're happy with the consistency, you grab your little baby bottle, and I'm just going to pour the liquid into the bottle. There's a little trick that I've seen nurses and parents, people working with milk do, where you want to test the temperature of the milk before you give it to the baby or the animal. So you get the milk and you dab it on your wrist, and you can feel the sensitivity. If it's too hot, you obviously don't want to give it. So you always want to make sure it's warm, not hot.
So now we have our mixture ready to go. It's more lukewarm rather than hot because we obviously don't want to burn our kitten's throat. The best thing to do when preparing the patient is either have the patient sit or lie down in the sternal recumbency. Do not place them on their backs at all, and we're going to support the head in a slightly elevated position. So I have our cat here in a cat burrito, but we're just going to slightly keep up the head. The cat burrito is going to prevent her from scratching me, but sometimes kittens do place your fingers on your paw when they're suckling, so that might happen. But we're going to lift up the head slightly, very gently, not all the way, but we're going to just lift it up just to open up that esophagus. Next, we're going to feed the animal. So we're going to introduce the nipple into the mouth, elevate the head a little bit. You might want to fold it up like this. You can see that? And we're going to hold the bottle up to avoid air being sucked. So the liquid's always filling up the nipple. Allow the patient to suckle at their own pace rather than squeezing the formula into the mouth. They might take a break and lick their mouth and then keep suckling, but keep going until they are full. They might chew and nibble on the nipple, that's totally fine. We're trying to simulate as much as possible a realistic, natural experience for them. Once they're all done, we're going to rinse this out with hot water and a good detergent, and then we're going to sterilize it for the next patient. So for monitor and care of the patient, we're going to clean and dry their face. So I'm just going to use this cloth here, and we're just going to clean their face. Like humans, they don't really enjoy having dry milk on their face, so we just want to make them as comfortable as possible. Dry that face a little bit, clean them up, make them nice and happy. If needs be, which most times we want to do, we're going to instigate toileting procedures after each feed. So how we would do that is we'd have our kidney dish here, or we would take them to the sink. That's when we would turn them on their back and press down on their bladder and get them to excrete urine. After all that's done, we're going to record down the details of each feeding session and monitor the growth with a daily weight of the animal. If the patient is not suckling well, discuss alternative options with the veterinarian. You might need to try other methods of feeding, including syringe feeding, tube feeding, to keep it warm so it's more enjoyable and they're more likely to eat, they're more willing to eat. So we keep it warm but not too hot. And there you go. Once they're all dried out and they're happy and they're full, they're good to go. So we will be doing this for this little kitten 4 times a day, and they'll be happy. Once they're all done, make sure that you clean your area, make sure it's all sterile. All the equipment that you use today is washed properly and cleaned. And you've got a happy little animal that's all fed. So how will the food that you have selected assist with the animal's condition? Out on weight, help them grow. This special formula can also be offered in either liquid or powder form to deliver a healthy sort of fatty acids, amino acids, and high quality vitamins and minerals. It's also low in lactose and loaded with calcium. So how to determine the amount of food required to feed your patient? Well, as always, I referenced the feeding guide on the back of the packaging. It's also available on the website, and you can calculate how much they will need depending on the animal's body weight and age. Always make sure that you're using an appropriate feeding method suitable to the species. There's not a lot of great help in feeding a cat a horse's sized feeding guide, so you always want to ensure that you're referencing the species amount to the animal. So in general summary, for when you do this at home with your own kitten, you want to make sure you have the Diavector in it, and you want to use the feeding guide at the back. Yeah, right there at the back. You always want to make sure that your equipment is sterile and that you clean it each time. You want to make sure it's fresh. Make sure you're using the right ingredients. Make sure this is not stale. You want to mix it together using warm water rather than hot. Keep the kitten in a nice safe procedure, and don't overextend the neck. You want to keep it a little bit elevated. And you're going to feed them as according to the feeding guide. You're going to hold it up so that there's no air bubbles. You want to keep it almost pretty much vertical. Yep, so vertical, that way. And then as soon as they're done, once they're done and they're nice and full, you're going to clean around their face in the area. Then if needs be, you toilet them and they're all good to go. Are there any other questions you had? You can always contact me in business hours if you have any further questions, or just give me a call. No? All good? Alright, too easy. Thank you very much for coming by, and I will give you your A4 sheet for any other questions.